Hello, my name is Tony. I'm going to be your student nurse today. Could I get your name and date of birth, please?
Tori Flamer, August 14th, 2003.
Thank you. And we're just going to shut the door for some privacy, Tori. Do you have any allergies?
No.
Just going to verify that on your band, and that looks correct. It looks like on our physician's orders, we're going to be doing a sterile wound cleaning today with a new dressing. And I'm just going to wash my hands and put on some gloves before we get started. Got our gloves on. So we're just going to start here. We're going to take our old dressing off, and we would just pull the tape off here. I'm going to leave this tape on it just to keep that in place. So we would look at our dressing after we take it off, and we would assess any drainage that might be on there, the amount and the color. So we could have serous drainage, serous sanguineous drainage, or sanguineous drainage. That would either be like a serous being like kind of a pus and sanguineous being bloody drainage. Then we would go ahead and dispose of the drainage. And before we did that, we would ask the client if they were in any pain and ask them to rate their pain on a scale of 1 to 10. And if they were in pain, then we could pre-medicate about 30 minutes prior to the assessment, so they weren't in any more pain while we were doing it. And then we'd go ahead and wash our hands, and then we'll set up our sterile field. So we'll just make sure that we have all of our supplies, and we'll start with opening the drape. Want to be careful not to touch any of this. Okay, just got the 1-inch border. And we'll go ahead and lay that away from us. And the 9 principles of sterile technique, we have first 1-inch border. Second, you must have sterile gloves on in order to touch anything in the sterile field. Limit the time the sterile field is open. Never turn your back on the sterile field. Anything below the waist is not sterile. Be honest if or when you do break sterility. Skin is not sterile, fluid flows in the direction of gravity, and the sterile water goes in the sterile bowl only. Otherwise, anything else wet is not sterile. And we would check our packaging expiration dates on these, which are, it's all intact, so we're not worrying about the sterility of these. We can go ahead and just put that in there and get rid of that. And then our tweezers here. And then we will pour some of our saline in there, and it's not expired. It expires in March of 2022, so that's good. So we'll go ahead and we'll pour some of our sterile water in there. Okay, and then we'll just set the lid down there like that. And we can get our sponges and everything in there. sterile field there, and I think I just touched the gauze as I was throwing it on there. So if that were to happen, I would go and get a new gauze and start over with the sterility of that. And that broke sterility as well, being over the 1-inch border. So I'll get a new one of those. And again, we would be checking the expiration dates of these packages and make sure they're intact, which they all are, and none of them are expired. So now that we've got all of our supplies here, we're not going to touch anything or rearrange anything. We're just going to make sure that we have everything. So we've got our gauze, our ABD pad, we have our tape, our sterile water bowl, our tweezers there. So now we can go ahead and we'd want to make sure we have the bed raised up and the table to waist height. And then we would put our sterile gloves on. And I'm gonna just move some of this stuff here. Don't want to touch this stuff. And we'll start with this one here. So we're gonna come here. Okay, and now that we've got that one on, we're going to go on the inside of the cup here. And open that up. We're going to keep our thumb away. Okay, so now that we've got our gloves on, we can touch our sterile field here and set it up the way we want to. So I'm just going to pull these open here. And we'll pull these apart. And we can put these ones in our sterile water. And then these we will use as our drawer. I broke that 1-inch border there with this pad, so I would get a new one. And those we will use as a dressing change. So we, again, like I said, we have the bed raised up here to our height. I'm gonna get my forceps on there, and then we can go ahead. I would then sacrifice this hand to hold my wound tubing here, and I would go around without crossing over, and then we'd go ahead and dispose of that. And then we've got our other one. Again, this hand is no longer sterile, so I'm not going to touch any of my sterile stuff with this hand. And then we would go around once more without crossing over and dispose of that. So now that that's done, we're done with our tweezers. So we'll get rid of those. And then we can go ahead and start our new dressing. And now that the wound site is clean, I can see the tissue better. I don't see any excess redness, inflammation, or any foul odors coming from the site. So that's good. That could indicate infection, and we're not seeing that. So again, like I said, that's good. And then we will go ahead and we will start with our split gauze here. And we'll spread it open and then just toss it on, because we don't want to touch it because it's not sterile. And then we will just toss this one on. We can toss our ABD pad on. And now that that's all covered, I can then touch it and tape it down. So we can now tape that down there. Take that down there as well. So we've got our new dressing there, and then I would take off my gloves and wash my hands. Ask the client, is there anything else I can get for you today? I've got time.
No.
Alrighty, well, thank you. And then I could document any findings and document the dressing change as well. And that's it.